Well, today I want to talk about birth defects. I want to talk about congenital events. I want to talk about inborn errors of metabolism. I want you to get a hold of the book, Epigenetics, The Death of the Genetic Theory of Disease Transmission, because not one single birth defect is caused by genetic transmission. They're all caused by nutritional deficiencies of the embryo. Of course, that's one of my favorite subjects because I've found the first non-human case of cystic fibrosis in a primate in any animal. First non-human case of cystic fibrosis in a rhesus monkey at Yerkes Primate Center in 1977. Emory University, Atlanta, Georgia, was hailed as a great discovery. In fact, later on, 2005, they said it was the greatest discovery in primates to help human health in the 20th century. And then they put a little bracket in there that said, Emory University refused to release the name of the young, and they were married to their genetic theory, which is a dead theory now. But at any rate, let's look at some of these. For instance, we've eliminated every birth defect you can name and 10 times that many you can't in the animal industry. Why not in humans? Well, because OBGYNs are more interested in women's cervixes and their breasts because that's where all the screening and all the cancer treatments make them money. Okay? They don't make any money by telling somebody to take the 90 essential nutrients, 60 minerals, 16 vitamins, 12 essential amino acids, 3 essential fatty acids to prevent these things. So this is why we spent a lot of effort getting it all in the book, Epigenetics, The Death of the Genetic Theory of Disease Transmission. So if you don't want children or grandchildren or nieces and nephews with birth defects, congenital events, inborn errors of metabolism, you better get this book and listen up here. You need to make sure that everybody who's getting married, baby showers, they're talking about anybody who's likely to have kids, you want to give them not a towel set or a linen set, or a $100 bill. You want to give them the 90 for life, and that way we're going to reduce the risk of birth defects, congenital events, and inborn errors of metabolism to almost zero, just like we did in the animal industry. Let's look at some of these birth defects. Things like Down syndrome is not genetically transmitted. It's caused by zinc deficiency in the first 2 minutes of pregnancy. I actually reversed a pregnancy for Lauren Knievel, Evel Knievel's niece-in-law. She was 2.5 months pregnant, and by 2 different laboratories was diagnosed with an embryo with Down syndrome. To make a long story short, gave her the extra zinc, gave her the 90 for life, full-term pregnancy, baby born normal. Okay? Well, same thing with, for instance, deafness, congenital deafness. That's not genetic. Although they're spending a lot of money looking for the gene. As they say in France, there ain't no gene, because congenital deafness is caused by a deficiency of manganese in the first 3 to 7 weeks of pregnancy. And then cleft palate, deficiency of zinc. Spina bifida, deficiency of folic acid. That's one of my 8 lawsuits against the FDA, which I prevailed. One of the reasons why there's folic acid in prenatal vitamins is because of my lawsuit. Okay? And then you're looking at club feet, club hands. These are all caused by zinc deficiency, right? Heart defects. These can be caused by any deficiencies, but also a zinc deficiency. Zinc is very important in preventing all these types of things. Then, let's see here. We're looking at inborn errors of metabolism. Type 1 diabetes. When the mom is making beta cells in the islets of Langerhans, the pancreas, you need about 50,000 cells in each islet of Langerhans, beta cells, to make insulin. But if she only has enough stuff, if you will, to make 5 beta cells per islet of Langerhans, you're going to be born with type 1 diabetes. Sickle cell anemia is caused by, of course, the stuff being missing. I want you to read the book Epigenetics to find out all about it, but the stuff being missing for the cells that manufacture hemoglobin in the bone marrow, they don't get it, and so that piece is left out. Same way with thalassemia. Thalassemia in white folks is sickle cell anemia in black folks. Sickle cell anemia in black folks is thalassemia in white folks. You can't have a genetic disease in black folks being found in white folks, so they gave it a different name. Lactose intolerance, fructose intolerance, protein and enzyme deficiencies that cause all kinds of metabolic things, metabolic errors. These things are all caused by nutritional deficiencies early in the embryonic life. And then, of course, congenital events. I like to call these congenital events. We're talking about people who were born asexual. You know, the crazy Aunt Ruth who died at 92, never had a date, and just never interested in boys, and she was the best cook and babysat for everybody, and everybody loved her, but she was just not interested in boys. She was asexual. Then there's bisexual, interested in boys and girls. You know, they can be convinced, say, look, you're genetically a male, and even though you're bisexual, you really should only chase females. Okay? And then there's the transgenders. These are people who, again, are born genetically one way, but because their brain didn't get everything it needed to have a standard development, they're interested in the other sex, when they should be interested in another sex, right? That's because mom was missing something when the preoptic hypothalamus was being formed in the brain. And then there's hermaphrodites, where they have physically 600 variations of hermaphrodites, 600 variations where they have both parts, both male and female parts, and medical doctors think they're doing a good thing. If they're biologically, genetically a female, they'll take off the male parts, but when the kid gets 10 years old, in his head, he thinks he's a male, even though genetically he was a female. And so here you go, and that's why you have so many suicides in these kids. The Europeans are much more compassionate. They wait till the kid's 10 years old and decide what they think they are, regardless of genetics. Then, of course, there's gay males and lesbian females. All of this is caused by nutritional deficiencies during embryonic life. And, we have an obligation to tell everybody the truth. Get a hold of the book, Epigenetics, The Death of the Genetic Theory of Disease Transmission, and you'll find out how you can control your destiny. And we'll be back after these messages. Okay, Doug, what pearls of wisdom do you have for us today?
Well, I got this Fox News story here, headlined, "Most Vegetarians Go Back to Meat and Fast." Now, that pretty well vindicates you, because that's something you've been talking about for a number of years. They say that becoming a vegetarian and staying a vegetarian are two different things. 84% of vegetarians end up eating meat again, most within a year, according to a new study that was published in the Huffington Post. They say specifically 53% of vegetarians are meat eaters again within 12 months, and more than 30% go back within just 3 months. They said of 11,000 people studied, 2% were vegetarians, 10 were former vegetarians, and 88% were lifelong meat eaters. Major reason for lapsing was social. They said they didn't get enough support from their friends and family about their vegetarian lifestyles. Say earlier research on points to health issues from staying meat-free. Smithsonian reports that some 35% of respondents to a separate survey of lapsed vegetarians said that poorer health drove them back to animal flesh. And there's some respondents to a survey in The Guardian, and they say one person says, "I will take a dead cow over anemia anytime." They said another lapsed vegetarian writes that the inconvenience of avoiding meat, and says, "Every cell in my body screaming protein, that's what you need." And they say a message focused on reduction instead of elimination of animal products may be more effective to create an overall decline in animal product consumption. But there you go, something you've been talking about for a number of years is proven to be true once again.
Well, thank you very much. And, of course, when you look at the top 20 longevity cultures, Doug, not one of them are vegetarians. They're all heavy meat eaters. They eat pork, they eat eggs, they eat cheese, dairy products, they eat raw meat. They really eat some crazy stuff. And this flies in the face of the people, whether they're religions or cultures, that said vegetarianism is good. And, of course, I could see doing it for 2 weeks as kind of a modified type of fast where you're just eating cooked vegetables instead of eating animal protein. But over the long haul, because there's such a high variation of nutrients in plants, whether it's carrots or beets or corn or grains, vegetables of all kinds, guess what? It's highly variable. The plants only need 3 minerals. Vertebrates, including hummingbirds, human beings, and elephants, require 60. And so you can't tell. You're eating a carrot. And, of course, being organically grown doesn't say anything about any more nutrition. It gives you reduced pollution, but no more nutrition. And so you can't say, well, I'm not going to supplement because I'm eating organic. Well, that won't help you, okay? And so you do need to supplement to make up the difference. If you're going to be a vegetarian, you can be successful being a vegetarian, but you're going to have to be obsessive about it. You're going to have to be knowledgeable. You're going to have to supplement 10 times heavier than if you were a meat eater. Okay, and this is, I've learned this over the years by what's on my autopsy table, as well as what I see in clinical situations where I see people at the big events, people who are at trade shows and things like that. And, of course, when people start out by being a vegetarian, as the study implies, they're all excited about it because they think they're doing something for the environment and this, that, and the other. And a lot of it's emotional as opposed to rational. And then when they start getting sick, they start getting anemic. They don't have enough B12. They don't have enough iron. They don't have enough energy because you require 60 essential minerals. Well, what if you're only getting 3? Because plants only need 3. Where are you going to get the other where are you going to get the other 57? Okay, and so you have to supplement. And if you're not supplementing, a vegetarian will fail every time. You must supplement if you're going to be a vegetarian. But that's the only way you can do it successfully is to supplement. Thank you very much, Doug. Thanks for bringing that one up. We'll be back with more Truth, Justice, and the Longevity Way on Dead Doctors Don't Lie after these messages. Okay, Doug, let's go to callers.
Well, let's head to Alabama. And Carl, you're on with Dr. Wallach.
Carl, you're on the air.
Yes, sir. I have a question about spinal stenosis and myelomalacia. We got that problem. My son got those two problems.
Okay, myelomalacia?
Yeah, myelomalacia.
Okay. Now, there's several names for the myelomalacia. Myelo means the bone marrow, and you can have fibrosis, myelofibrosis. You can have myelosclerosis. Another name for it is myelomalacia. And what happens is when you have, bless you, when you have raging osteoporosis, which you have if you have spinal stenosis, okay, I'm assuming, Carl, the spinal stenosis is in yourself, or is that in your son?
Sir?
Is the spinal stenosis in you or your son?
My son.
Okay, and he's also been diagnosed with myelomalacia. Yeah, and this is all related to osteoporosis. What happens is the bone marrow cavity, which normally makes red blood cells, white blood cells, and platelets and other stuff, gets filled up with connective tissue, bone matrix, if you will, the sort of the rebar of the bone, and it squeezes out the cells that make red blood cells so people can show up anemic. They can squeeze out the cells that make white blood cells and not be able to respond to infections. They can squeeze the cells that make platelets and bleed from any minor little bump and scrape. And so how much does your son weigh?
He's probably about 240, 250.
Okay. All right. Does he have any other issues that you know about? Asthma, bronchitis, skin problems? Has his appendix been taken out?
No, sir, but he did have a stroke a little while back, a few months back.
Okay. Is this a bleeding stroke or a blood clot stroke?
It's a blood clot stroke.
Okay. All right. And let's see here. Shar, are you there?
I'm here.
Okay. What would you do for this young fellow's osteoporosis, spinal stenosis, myelomalacia, which is myelosclerosis, myelofibrosis, which you're very familiar with? 250 pounds. He's had a blood clot type of stroke. What would you do for this young fella?
He needs three.
Yep.
He needs three healthy. I would give him healthy bone and joint packs because basically he needs calcium though.
Well, he needs the minerals. You're exactly right. He needs vitamin D3 and vitamin C and vitamin A and magnesium and phosphorus. He needs a whole drill. But hang on, Carl. Shar and I'll be back after these messages. Okay, let's see here. Doug, we're going right back to Alabama and Carl. Okay, Shar, I'm going to kind of break that down for Carl in a second, the three healthy bone and joint packs for his spinal stenosis, myelosclerosis. But he also had a blood clot type of stroke. What would you do for that?
I would give him the nightly essence because that will dissolve the blood clots.
Okay, nightly essence, as you point out, is a blend of enzymes, one of which is nattokinase, and nattokinase is legendary for dissolving blood clots. Perfect. So, 250 pounds, three of the healthy bone and joint packs would be 1 ounce of the OsteoFX Plus at breakfast, lunch, and dinner. It'd be 2 scoops of the Beyond Tangerine 2.0 NutriCrystals at breakfast, lunch, and dinner. 3 of the EFA Pluses at breakfast, lunch, and dinner. And then, of course, he needs 20 glucogel a day, 5 at breakfast, 5 at lunch, 5 at dinner, and 5 at bedtime with a glass of water. And then I'd have him take 9 of the nightly ensigns a day, be 3 at breakfast, 3 at lunch, and 3 at bedtime with a glass of water. And I would also throw in the ASAP for weight loss. How tall is your son, Carl?
He's about 6 feet.
Okay, 6 feet. Yeah, I'd like him to lose 50 pounds. And so that'll help him in all these areas. And so I'd like him to get also the ASAP, just a single bottle. Have him put a dropper full, not a drop, but a dropper full under his tongue 30 minutes before he eats each meal, so 3 times a day. And leave it absorb through his oral tissues. Don't let him swallow it because he won't get the benefit. He's got to absorb through his oral tissues, almost like an IV injection. And within a couple of days to a week, he'll be able to lose a half a pound to 2 pounds a day. And I want you to call me every couple of weeks, and I want to know what he weighs and how he's feeling and so forth. He'll have energy, and of course, the whole idea is to support and promote maintenance repair of the bones, the cartilage, the ligaments, and the bone marrow. Okay, Doug, we got time to start another one?
Yeah, let's head to Utah. And Steve, you're on with Dr. Wallach.
Hello, Steve, you're on the air.
Hello, Dr. Wallach.
Yes, sir. How can we help you?
Well, okay, I have a dad. My dad went to the hospital in July for a septic knee, like where his knees were all swollen up and he couldn't walk. And they put him on an antibiotic, which caused his kidneys to shut down. And then they switched him over to another antibiotic, Cipro, and he ended up spending about 4 months in the hospital.
Oh, my. Was he on dialysis?
And no, his kidney function was able to pick back up. But he wasn't eating, and they sent him home basically on hospice saying he had 3 days to live. And this was about 2 months ago.
Okay.
And when I got him home, I just cut all medications, and I just started giving him basically your Tropical Plus and your OsteoFX and EFAs.
Okay. Mm-hmm.
And he wasn't able to eat or anything. He wasn't eating when he was in the hospital. He was looked like he just got out of concentration camp.
Oh, my.
But now he's up and walking, moving around again. But today he came and showed me his knees. His knees are swollen back up again.
Mm-hmm. Okay. Well, how much does he weigh now, you think? Even though he's lost all this weight, what do you think he weighs?
No more than 150.
Okay. Well, hang on, Steve. We'll be back. We'll give you a program for your dad after these messages. Okay. Let's see here. Shar, his son is 150 pounds, and he's got swollen knees, and they've given him antibiotics, and that didn't seem to help, and only knock his kidneys down and put him in the hospital. And so what would you do for a guy 150 pounds has swollen knees?
Okay, well, has he got swollen knees because he's got low blood protein? Is that possible?
It's possible, but I'd go for the bigger picture. Okay, how about some healthy bone and joint packs?
Okay, yep.
Let's go for 2 healthy bone and joint packs. And I would have him take 1 ounce of the Osteo at breakfast and dinner, 2 scoops of the Beyond Tangerine 2.0 NutriCrystals at breakfast and dinner, 3 of the EFA Pluses at breakfast and dinner, and then 15 glucogel a day, 5 at breakfast, 5 at lunch, 5 at dinner, all to be accomplished by the 2 healthy bone and joint packs. And as Shar said, you get edema and that sort of thing when you have low protein. What would be the quickest way to get his protein up, Shar?
Eggs.
Oh, there you go. That was enthusiastic. Okay. Yeah, eggs. 150 pounds, I'd have him eat 6 to 8 eggs a day, poached or soft scrambled butter or soft boiled with soft yolks. And also, we have in the 2 healthy bone and joint packs he's going to get, each one will come with a wide mouth jar of the CM cream, which is an analgesic, meaning pain relieving, and also an anti-inflammatory cream. You can do that lavishly all over his knees, and it'll give him relief both in the swelling part as well as the pain. Give us a call every couple of weeks, Steve. Let us know how son is doing. Okay, Doug, let's go to callers.
Well, let's head to Knoxville, Tennessee, and Israel. You're on with Dr. Wallach.
Oh, Israel, you're on the air.
Yes, Dr. Wallach. I'm bipolar. I suffer from bipolar disorder, and I spoke with Dr. Glidden 2 months ago, and I'm on your product, on Ultimate Selenium, 90 capsules, 4 packs, and Beyond Tangerine and stuff. And I would like to know what else do I need to do, because I also have a high triglycerides.
Okay.
And I have a little bit of a hyperthyroid, I've been told, by my last time I had my...
So your thyroid is a little overactive.
Yes.
Okay. All right, how much do you weigh, Israel?
205 pounds, and I'm 5'8".
Okay. Now, do you have any history of any other stuff? Asthma as a kid, skin problems, any eczema?
No, I had no asthma. I don't remember or don't recall to be allergic to anything, but I've been diagnosed as a bipolar when I was 17 years old.
Okay. And, all right. Let me ask you a couple more questions here. Did you have any history of like really serious constipation where you needed to take laxatives, or diarrhea where you had to take something to stop the diarrhea?
I have, yes.
Mm-hmm. Okay. You have any brothers and sisters?
I have a brother that passed away, and I have 2 sisters in Chicago.
What did your brother die from?
I think he was murdered.
Oh, my goodness gracious.
The cops ruled it as suicide, but we don't know. We kind of question because they gave me two stories.
Yeah. Okay. Well, let's pray about that one. My goodness. Okay. Let's see here. Okay. Shar, what would you do for somebody that has kind of a brain physiology problem here, bipolar, and what causes, things like bipolar and things like depression and manic depression and psychoses, schizophrenia? What causes all those things, Shar?
It's all a lack of nutrition.
Well, yep. How many nutrients does a brain need, Shar?
All 90 essential nutrients.
Okay. So, 205 pounds. What would you suggest for this guy?
I would give him 2 healthy brain and heart packs, and also I would add in the de-stress for sure.
Okay, yep, for brain metabolism, exactly. So, Char's exactly right, Israel. What I would have you do is take 2 complete healthy brain and heart packs. Get yourself the de-stress capsules, 2 bottles a month. So we want you to take 3 of the de-stress at breakfast and dinner. Take 1 ounce of the OsteoFX Plus at breakfast and dinner. 3 of the selenium twice a day. 2 scoops of Beyond Tangerine 2.0 NutriCrystal twice a day, 3 of the EFA Pluses twice a day, and 3 of the EFAs twice a day. All that will be accomplished by the 2 healthy, brain and heart packs, as well as the 2 bottles of the D-Stress capsules, capital D like David, dash stress.
But I'm already on a Healthy Start Pack.
Yeah. Okay, what you do to make the Healthy Start Pack a Healthy Brain and Heart Pack is get 2 bottles of selenium per month, okay? And then I would also get the extra bottles of the EFAs, 2 bottles of EFAs, so you could take 3 EFAs twice a day and 3 selenium twice a day, in addition to everything else you're taking. Also, how many eggs would you have Israel take, Shar?
Oh, at least 10 a day.
Yep, 205 pounds. Yep, 10 to 12 eggs a day, poached, soft-boiled, soft yolk, soft poached, soft yolk, soft scrambled butter. And the thyroid, in addition to staying off all the bad stuff, no fried foods, no processed meats, no oils, no gluten, no wheat, brown, and oats, I would also stay away from cruciferous vegetables. Anything that has to do with the thyroid gland, you want to stay away from cruciferous vegetables. That would be things like cabbage, broccoli, cauliflower, Brussels sprouts, kale. That includes things like, all the stuff made out of cabbage, right? Anything made from cabbage. So give us a call every couple of weeks, Israel. Let us know how you're doing, and we'll be happy to walk through this with you. But I think
I have one more question for my dad. He has heart problems, and his feet are swollen. What do you recommend for him? And now we're having those wraps around his feet, and they do it twice a week.
Yeah, well, the wraps might help with some of the edema around his legs. But do you know what type of heart problem he has?
I think it's called congestion heart failure, but he has that since he was young. So,
Is he about your size?
He's 87 years old and he's about 180 pounds.
Okay, so let's say it is congestive heart failure. I would give him exactly the same thing you're getting, and do exactly the same thing for him that you're doing, because what is missing when you have congestive heart failure is in the de-stress capsules. And I would go ahead and give him the 3 de-stress twice a day and the 2 healthy brain and heart packs per month, and stay away from all the bad stuff. No fried foods, no processed meats, no oils, no gluten. Give me a call on both your dad and yourself, Israel. Okay, Doug, let's go to callers.
Oh, let's head to California. And Ann, you're on with Dr. Wallach.
Well, Ann, you're on the air.
Hi, I have tendonitis of the knee. I've had a series of chelation therapies, and I'm wondering if it probably wasn't pulling out minerals, and I am on the Healthy Bone and Joint Pack, but I wondered how long will it take to heal this tendonitis?
Okay, is that in one knee or both knees? Or
just one.
Okay, and how old are you?
69.
Okay, and then how much do you weigh?
140.
Okay. Do you have any other issues? Asthma, bronchitis, skin problems, high blood pressure?
Scoliosis.
Okay. All right, and do you have any brothers and sisters?
Yes.
Do they have any health problems, any asthma, bronchitis, skin problems, constipation, diarrhea, et cetera, et cetera?
No.
Okay. All right. Well, let's see here. The tendons behind your knees and in front of your knees also have the same problem that your back has when you have scoliosis. What would you do for cartilage, ligaments, tendons, connective tissue, Shar, for a 140-pound lady?
Healthy Bone and Joint Pack.
Okay. I'd be a little heavy. I'd go ahead and give her 2 healthy bone and joint packs. Okay, because you got all this stuff going on. And I'd get an inversion table, Ann, so you can invert upside down. But I wouldn't go from 0 to upside down immediately. I'd take about 2 months to get there. Go ahead and take 1 ounce of the OsteoX Plus at breakfast and dinner, 2 scoops of the Ontane Tangerine 2.0 breakfast and dinner, 3 of the EFA Pluses at breakfast and dinner, 15 glucogel a day, 5 at breakfast, 5 at lunch, 5 at dinner, and get that inversion table, and take about 2 months to get up to where you're vertical, and I think you're going to be happy with the results. Don't forget the CM cream. Use it on your tendonitis. Use it on your back. Use it on your knee. We'll be back after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Young's Youth 90 for Life Crusade. And Doug, let's go to callers.
All right, let's head to St. Louis, Missouri. And Marie, you're on with Dr. Wallach.
Hello, Marie. You're on the air.
Hey, Dr. Wallach. I am calling on behalf of a couple of family members. They each have Hashimoto's hypothyroidism, and they've had it for about 15 years. And these 2 family members are not related. One is a daughter-in-law, one's my husband. And I am just wondering what you would recommend for that. And after that, I have a second question.
Okay, well, let's see if we can get this in quickly then. How much does your husband weigh?
About 190.
Okay, and how much does your daughter weigh?
My daughter-in-law, maybe 140.
Okay. All right. So, basically, everybody needs the 90 essential nutrients, okay?
Yep. He's on that.
Okay, good. Char, what would you have her avoid, and her daughter-in-law and her husband, what would you have them avoid in their diets?
They got to avoid cruciferous vegetables. I can't pronounce it.
No, you did good. Okay, yeah, no cruciferous vegetables. We're talking about no cabbage, broccoli, cauliflower, Brussels sprouts, kale, and also no fried foods, no processed meats. The nitrates in processed meats are very bad for the thyroid gland. Deli slices, sandwich meats, sausage, ham, bacon, bologna, salami, that kind of stuff. And then I would give them both, even though there's a 50-pound difference here, I'd give them both the same program. I'd go ahead and do they have any other issues? Arthritis, noisy joints, high blood pressure, diabetes, anything?
My daughter-in-law has endometriosis, and that's been severe, and just other inflammatory type issues.
What about your husband?
He has had some back issues that he's had surgery for, and because we've been on your supplement programs, particularly the Healthy Start Pack with additional bone and joint supplementary things, he's doing pretty well.
Okay, good.
Yeah.
All right, well, we need to move along here, but thank you. Okay, I want to go ahead and take this so we can get going here quickly. So both of them, I would have them take 2 of the Healthy Bone and Joint Packs per month. That's the Healthy Start Pack plus the plus the Glucogel and also the CM Cream. And so I'd have them both take 2 Healthy Bone and Joint Packs per month. Full dose of everything at breakfast, full dose of everything at dinner. They can use the CM cream lavishly on their back, on their knees, hips and joints all over the place. For the thyroid, what would you give for the thyroid, Char?
Ocean's Gold.
Ocean's Gold, exactly right. They both need 3 tablets twice a day. That's 2 bottles a month of the Ocean's Gold, and it's designed, of course, to give really great support, metabolic support for the thyroid gland. Usually within a couple of months, they're able to significantly reduce or wean off their medication. And then endometriosis, what would you do for dysmenorrhea, woman's problems, and all that kind of stuff?
I'll give them the Woman's FX.
Yep, 2 quarts a month. For her, that'll be 1 ounce of the Woman's FX twice a day. And she cannot use tampons anymore. Tampons are usually the cause of endometriosis in modern days because it's closed. Instead of being a closed system, it's an open system from the opening of the vagina all the way up into the fallopian tubes into the body cavity. And so when you block up the flow of the endometrium, the lining of the uterus, and the blood clots and so forth during a period, it flows backwards up into the body cavity, and these cells don't die. They actually get transplanted and set up housekeeping in the body, and they're sensitive to estrogen. And so they do swell during the periods and so forth and cause discomfort and pain. And so to stop the ongoing problem, can't use tampons. Okay, but 1 ounce twice a day per 100 pounds of body weight of the Woman's FX, ounce breakfast, ounce of dinner, 2 quarts a month. Usually within a cycle or 2, you see major improvement in the discomforts of endometriosis. But how much time we have here, Doug?
About 10 seconds.
10 seconds. Well, I'm going to take it and remind everybody to get my new book out, Epigenetics, The Death of the Genetic Theory of Disease Transmission, and avoid birth defects, avoid inborn errors of metabolism, and avoid congenital events. We'll be back another day. Thank you so much, Shar. Super job. Thank you so much, Doug and Richard. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.